Hi there, my name is Todd Hurst. I'm a cardiologist who specializes in the prevention of heart disease. Welcome to Your Health Questions Answered. If you have had side effects from statin medications, you are not alone. Although about 90% of people take statins with no problems, there are a lot of people who have had side effects because statins are so frequently prescribed. Far and away the most frequent side effect of statins is muscle pain. Typically, the pain is all over and not isolated to a specific body part. It can be challenging to determine if the muscle pain is caused by the statin, as muscle aches are a common complaint for most of us, whether we are on a statin or not. Before we get started, I will emphasize that this information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. So why is this important? People who have stopped a statin because of side effects and aren't able or willing to take another statin have a higher risk of heart attack and stroke than those who can find a statin that works for them. The good news is that most people find a statin or use an alternative regimen, like taking the medication every other day, for example, that allows them to be protected from heart disease without the side effects. Here are the most common questions I get from my patients who may have muscle pain from a statin medication. Number one, is this life-threatening? The answer is almost never. Life-threatening problems on statin medications are exceedingly rare. However, persistent muscle pain after stopping the medicine needs urgent medical evaluation. Another question I get commonly is, do I really need to be on a statin? For some people, the answer is no. Statin medications are beneficial if you have a high risk of heart disease or stroke, but if you're not at high risk, there's likely little benefit. Another question that I get is, how can I tell if it's the statin that's causing my symptoms? Sometimes it's hard to tell. If you're not sure, I often recommend stopping the statin for a few weeks. If the symptoms don't change, restart the statin. If the symptoms go away, though, and they weren't severe, I typically recommend taking the statin again to see if the problem comes back. I also recommend reviewing other medications to see if there are potential drug interactions with the statin, and blood tests to check thyroid and vitamin D levels can also be helpful. If you are trying to decide if taking a statin would be right for you, download my free guide, Should I Take a Statin? This gives a balanced view of the risks and benefits of taking statin medications so that you can make the right decision for your goals. There is a link below this video. If you're at high risk for heart disease or stroke, your risk will be lower if you are taking a statin medication. However, taking a medication to prevent future problems that causes you to be miserable today doesn't make sense to anyone. If you have had muscle pain problems on statins, talk to your doctor to see if there is a change that can be made to make a statin work for you. Next week's video, we'll talk again about part 2 on muscle pain from statins, common questions. Thanks for watching. If you like this video, hit the like button below, share it with your friends and family, and be sure to subscribe. I would love to connect with you on Facebook, Twitter, Pinterest, or Instagram, and you can join my Better Health community at toddhurstmd.com, where we talk about your better health, better life, and better weight loss.